Again, I welcome you to the issues on IKD 106.1 FM. The day is still fresh, I must tell you, because it's just 3 minutes past the hour of 11. And yes, of course, it's a new month. So I should say to all of our listeners out there that happy new month is the month of June. And of course, we hope that the month stays positive for every of our listeners out there. Welcome to the issues on IKD 106.1 FM, where we talk matters that matters, where we talk about matters that concerns our community, our society, and of course our nation at large. But then of course Thursday is set aside for a healthy conversation where we talk about our health. They say health is wealth, and that is why in partnership and of course in collaboration with General Hospital Ikorodu, we have decided to give you tips, healthy tips, awareness on health matters from around every important sector. So I say welcome to the issues on IKD 106.1 FM. My name is Ade Bambo, or Payemi. In as much as a lot of us out there celebrates the new month of June, I should also let you know that today happens to be the Global Parents Day. Yes, so we celebrate every parent out there, to every mothers, every fathers out there. We say happy Global Parents Day. This is a day set aside to create awareness on proper parenting, and that is why we have Ikorodu General Hospital today to help enlighten us on convulsion. When we talk about convulsion, this is a sickness that is common amongst children. So today on the issues, we talk about convulsion in children. Everything you need to know about convulsion, we would have that conversation here today. All you need to do is sit back and, of course, enjoy. And while you're enjoying, you learn and you stay educated on the conversation, convulsion in children. To do justice to the conversation, with me in the studio, I have Dr. Maegun Rilwan from General Hospital Ikorodu. And, of course, he's a prominent personality when you talk about a medical practitioner who understands his onion so well. We go on a very short breather. When we return, the issues continues on IKD 106.1 FM. Good morning. You're welcome back. And of course, do not forget that you can join the conversation by dialing our studio lines 0904-081-1061 or 0904-082-1061. You can also listen to us from all over the world via website www.ikd1061fm.ng. During the opening glee, I told us that today happens to be Global Parents Day, and our focus for today on the issues is convulsion in children. First off, I have to say good morning to you, Dr. Maegun Rilwan.
Good morning.
It's good to have you in the studio.
Yeah, it's a pleasure.
And I should say happy new month to you.
Happy new month to you and everybody listening to us all over the world.
Yes, thank you so very much for joining us.
Thank you.
Today we want to talk about convulsion in children. And of course, this is something that creates this serious panic among parents, especially if it is for the first time. A lot of parents want to wonder, what is this? What is wrong? Is this a spiritual attack? And there are a lot of questions that come out of convulsion, especially if it happens for the first time. But you being versed with what convulsion is, how do you define convulsion? What exactly is convulsion?
Thank you once again for having me on the program. Yes. And I want to really commend your initiative of choosing a topic like this.
Thank you.
This is because, like you pointed out, it's actually a scary thing, and many people do many wrong things. And apart from taking care of the convulsion, we also have to take care of the bad output of their good intention. I mean, trying to take care of the baby, they do many things that are wrong that harm the baby even more than the convulsion. But going straight to your question, so we define convulsion as the motor manifestation of seizures.
The motor manifestation of seizures.
So I will break that down so that all our listeners can understand what I'm saying. Now, what we mean motor manifestation means that the patient is convulsing, means that there is abnormal body movement. Now, but this body movement is not just from the body, it's coming from the brain. So the abnormality occurs in the brain and is now manifesting as abnormal body movement. So the abnormality in the brain is what we call seizure.
Okay.
Which, because we know that our brains are made up of neuronal tissues that are like batteries. Okay. So when there is any issue with them, they discharge wrongly.
So when there's a fault, there's a discharge of wrong discharge,
functioning. That's where it occurs in the brain. It now manifests in the body as abnormal body movement. So it's the abnormal body movement that we are seeing. That's the convulsion. So we say it is the motor manifestation of seizures, where seizure is abnormality in the discharge of the neuronal tissue. So when a patient is convulsing, the problem is not from the hand is shaking, the leg is shaking, the lips is twitching, is from the brain, and that is what makes it scary, because what we are seeing is actually a manifestation of a greater problem, and the greater problem occurs in the brain. And we all know that the brain is a delicate organ, and so when patients are convulsing, everybody, we don't need to panic, but we need to know that we have a serious issue at hand. So back to the definition, convulsion is defined as motor manifestation of seizure, while seizure is abnormal discharge of the neuronal cells in the brain.
For those of us listening, I can tell you this conversation is going to be very, very interesting and educative. I for one, when you said that it is actually a manifestation from the brain, originally when you see someone convulsing, the hands are shaky, the legs and all of that, I used to think it was actually something from the body system. But according to you now, you are saying that this is something that has to do with the brain. So convulsion starts from the brain and then it moves straight to the body system. So
it manifests in the body. Why this is important is we have other manifestations of seizures. Now we said we have motor manifestation. That's the one we call convulsion. That's the one people see. But there could be sensory. Some people might be convulsing, and what they see is they see things people are not seeing. They hear things people are not
hearing.
And that is just it. Some they just behave abnormally, and it's just that's how they manifest. How the abnormal neuronal discharge in the brain is manifesting in them. But the most dramatic one is the motor manifestation, and that's the one we refer to as convulsion,
which is very common,
which is a common one. But we have other ones, the sensory manifestation and others that manifest other way, behavioral manifestation that manifest other ways. But the convulsion itself is the motor manifestation of seizures.
Okay, I would ask you now that with the way you've defined and explained this, can we say that convulsion is a spiritual thing? Some believe that is a spiritual thing, especially the Yoruba land. Like I always say, they will tell you, Isha Ayere, Ayetu today, and all of that. Convulsion in children, is it a spiritual thing or it's just normal for it to occur?
Okay, well, it's not a spiritual thing. Of course, as doctors, we actually trained to manage things in the physical world. So we are not spiritualists. We don't know about the spiritual world. I mean, as doctors, but we understand that there are explanations, scientific explanation for these things. And once there is a scientific explanation for something, I think the normal thing is for us to follow it. It's like saying, "Oh, I don't have light because there is no NEPA, or because there is no NEPA in
supply." Yes,
is it not better to walk towards NEPA and get light than to say, "Oh, somebody doesn't like me and that's why I don't have light." So of course, maybe somebody doesn't like you and you don't have light. Well, I don't know, but if we have a normal cause and effect, I think the ideal thing is to follow the cause and effect that are scientifically proven and that can be managed medically.
I get your message there when you give that instance of no power supply. So rather than just say somebody is doing you somewhere,
it's better you go to the root.
Exactly. So can we say that convulsion is hereditary? Because in some cases we will also hear that it has happened before to the person's father, it has happened to the mother, that is why the child is also doing it. And some cases too, we have it that even the parents are not in that circle at all, but then the children have it. So is convulsion hereditary?
Yes, convulsion can be hereditary. A lot of basis for convulsion. We have many classifications of convulsion, but obviously genetic bases are very, very strong. The most popular form of convulsion is the one we call febrile convulsion.
Okay.
Febrile convulsion means that a baby has fever and then convulsed, and it's seen in babies within 6 months and 60 months. 6 months and 60 months. That's 6 months to 5 years. So when we have these babies, once they have fever, the temperature rises suddenly, then they convulse. So that's febrile convulsion. But even this febrile convulsion has genetic basis. Children who have siblings with febrile convulsion, who have parents with febrile convulsion, they are more likely to have febrile convulsion and even have recurrent febrile convulsion. So then we have other forms of seizures, convulsions. Maybe we still get to the point of epilepsy.
Yes.
So when we get to the level of epilepsy too, a lot of them have genetic basis. So obviously there is gene has a lot to do when we talk about convulsion.
So it could be hereditary.
Very, very possible.
Okay, if you're just joining us, it is the issues on IKD 106.1 FM, and with me in the studio today I have Dr. Maegun Rilwan from General Hospital Ikorodu, where we're talking about everything you need to know when we talk about convulsion in children. Earlier you said that when you talk about convulsion, that has to do with fever. There's a particular age to a particular age, but convulsion in itself, before we even talk about the types of convulsion now, convulsion in itself, what is the age bracket to the children that are affected by convulsion? Is there any age to it, or there is no age at all?
There is no age at all. In fact, we have babies that are born today and they start convulsing today.
A day-old baby.
In fact, we have a 4-hour-old babies that are convulsing.
Wow.
Now, so that will now take us to the causes of convulsion. Now, babies that are born and they don't cry immediately, we say they suffer birth asphyxia. So if the birth asphyxia is so severe, one of the manifestations of the birth asphyxia is that the baby starts convulsing, and this can occur as early as the 4th hour of life. So that can happen. Then when babies have low sugar, even new baby, adults, anybody that has low sugar, that we call hypoglycemia, this kind of patient can convulse at whatever age. Then we have people with fever, as I mentioned, from 5 to 6 months to 60 months. They can also convulse,
which is 5 years,
which is 6 months to 5 years. They can convulse. Anybody with meningitis, children, adults, at any age, they can convulse. Malaria can lead to convulsion. Malaria infection can lead to convulsion in any age group. So that means that convulsion is a common symptom that is seen in all age groups. Adult as well, even elderly can convulse.
Even elderly person
can convulse. But convulsion is mostly seen in younger children. The causes of convulsion are commoner in younger children than adults. So mostly is seen more in the pediatric age group.
When you talked about the causes earlier, and I was expecting to hear something that has to do with maybe the environment, maybe poverty. Can we say that the environment sometimes could bring about convulsion? Because you would agree with me that in most cases, when you see children who are convulsing, maybe they are not too comfortable, or the environment is not very, very appreciative. Is environment and maybe lack of money, which we call poverty, could they be another factor?
Now, I've started by saying that babies that do not cry at birth can have convulsion. So usually these babies that do not cry at birth, they were delivered at home, or they were delivered at somewhere. They were not delivered in the hospital. And babies that are more likely to be delivered outside the hospital are babies of people of low socioeconomic status. Now, the other things are infections. Generally, infections are seen more in low socioeconomic status. When the economic status rises, then the parents also learn more about hygiene. Educated mothers, educated parents are more likely to keep their environment clean and so prevent infection in their children. Also, educated and high socioeconomic class individuals, parents are more likely to present in the hospital earlier when the babies are sick, and so they are better taken care of to prevent the complication that will lead to convulsion and epilepsy later in life. So low socioeconomic status is very, very, very important when we are talking about the incidence and prevalence of convulsion and epilepsy as a whole.
We will talk briefly about epilepsy, because that seems to be like the matured stage in a way. But then, like I said, those of you at home, you can join the conversation if at all you have questions to ask Dr. Maegun Rilwan from General Hospital Ikorodu. Today we talk about everything that you need to know about convulsion in children. This is important. This is germane because today happens to be the Global Parents Day, and it's very important for parents to be aware of how to take care of their children. Before we talk about the preventive measures, before we talk about how to handle situations when convulsion occurs, I'd like for us to talk about the types of convulsion, because you mentioned that slightly. I used to think convulsion is just convulsion, that there are no types of convulsion. So let's talk about the types of convulsions that we have.
Okay, so usually when we want to talk about convulsion, there are several reasons, several ways of classifying convulsion. But for the public audience, I will just talk about provoked and unprovoked seizures, unprovoked convulsion. Because of our terminologies, ideally, technically, these things are different, but people use them interchangeably. But that's not what they are. But so let's stick to convulsion. So we can have provoked or unprovoked convulsion. Now, discussing the provoked one, or those that have to do with an acute, a particular problem that we can point at, like the one I pointed out, a baby was delivered and did not cry and started convulsing. So that was provoked by baby not crying. A baby has meningitis, has an infection of the brain, and from that baby started convulsing. That is also a provoked one, something we know that is causing that acute cause of convulsion. A patient has malaria and probably went into the form of what we call severe malaria and started convulsing. Those are provoked seizures. A baby has febrile convulsion, like I mentioned, the temperature went high suddenly within the age of 6 months and 16 months, and then the baby started convulsing. Those are acute causes. A patient has hypoglycemia, the sugar went down suddenly and then the baby started convulsing. Those are provoked seizures. Now, for provoked seizures, the good thing is we know what is causing it, take care of it, and the convulsion stops. So, and those are many times, those are more reassuring in terms of the patient comes, you look at what are the causes of the convulsion, you treat the causes, stop the convulsion, and then we are good to go. Why the unprovoked seizure? And that is the one we know, we popularly call the epilepsy as a whole. So we define epilepsy as generally, clinically, as two unprovoked seizures.
Two unprovoked
seizures occurring more than 24 hours apart. That means that a patient is a baby, a child is just sitting down and then started having abnormal body movement. There was no low hypoglycemia, the sugar was not low, none of the electrolytes were bad, there was no fever, nothing. Baby just fell down and started convulsing. And this now happened again more than 24 hours apart. So this is why we define epilepsy. Though in our own clinical term we have other definition, but generally for people, for what we want people to know is that when we have two unprovoked seizures occurring more than 24 hours apart, then this is what we call epilepsy. Now, the causes of epilepsy, it can be a complication of the provoked seizures. Like a baby that was delivered.
It can be, sorry, I need to get that.
Yes, it can be a complication of the I define broadly into provoked and unprovoked. Unprovoked is the epilepsy. Now, it can be a complication of the provoked seizure. Provoked, like a baby had meningitis. We treated the meningitis and the patient seems calm. The seizure subsided. Then later in life, the patient started having unprovoked seizure convulsion. That is, as I had meningitis 5 years ago, now we now realize that the baby is now convulsing. But when we look at the brain, we realize that the convulsion, the meningitis he had then left a scar on the brain.
Okay.
So when this is the scar on the brain that is now causing this convulsion that is not associated with fever, not associated with metabolic derangement and leading to epilepsy. That can occur. Then we also have some genetic basis too of convulsion. There are some genetic syndromes, we call them. That when we see them, those are even more genetic. What I mean is that we ask for family history, there will be one relative or the other that actually convulses unprovoked. That is adults going around driving their cars and then they start convulsing suddenly. So if there is a family history of that, it increases the chance of patients having unprovoked seizure that we call epilepsy. So it can happen. Where I'm going is that epilepsy can occur from a complication of a provoked seizure, a provoked convulsion, something of acute now leading to a complication leading to epilepsy. It can also occur from genetic basis. There are some syndromes, Sturge-Weber and all those syndromes that can cause epilepsy in patients. Also, one of the causes of epilepsy too can be brain tumor.
Brain tumor.
So if I point to that too, they just find out that this patient is convulsing, and when we examine, sometimes when you now realize that there is a brain tumor, many times when you remove the brain tumor, the epilepsy stops. So which also takes us to how to manage epilepsy. Some of them, surgical intervention might help to
we will even get there. We'll get to
but basically to the classification broadly is that it can be provoked or unprovoked. Provoked is that we have an acute illness or acute disturbance leading to the epilepsy. Why the leading to the convulsion. Why the unprovoked one, commonly called epilepsy, is the one that occurs without any abnormality. Obviously, I mean particularly fever, hypoglycemia, electrolyte derangement. All these things are not there, and the baby just started convulsing. So those are the broadly, I mean, in the public health realm. Yeah, that's better defined. In our own realm, we have a lot of definitions.
Yes, I can imagine.
It's important we stick to what benefits the populace.
Okay, so I would also take in text messages if you want to send in text messages or WhatsApp messages to ask questions from Dr. Maego Real One, where we talk about convulsion in children on 0904082161. That's 0904082161. We still talk about convulsion in children. Now, doctor, you talked about convulsion, and of course you gave a clear understanding on epilepsy. Now, when we look at family history, this is one thing people don't take for granted when you want to get married. When you see a family, the other family will tell you, go and check their family history. These days, they don't just go and bring the blood group, the genotype of whoever you want to marry anymore. They will talk about check their family history. Do they have this sickness and whatever? So, talking about epilepsy, convulsion, are there signs that one will just look at the woman and say, family only? Are there signs that one can just see and say that this family has epilepsy, aside the fact that maybe we hear that the family is epileptic?
Okay.
Now I want to know the signs for either convulsion or epilepsy, if there are any.
Okay. Maybe I should, because the word is not very sensitive. So maybe I should say that not just the woman, the man too.
Yes.
So it can happen from any of the signs.
True.
So, but the truth is that for epilepsy, more than 50% of cases, the patient would have been having these seizures in childhood. That is in childhood. But I understand that in some cases it might not be the person, the father or mother. It might be the uncle or something like that that is affected. So if we are talking about genetic basis, there are some syndromes that when we find those syndromes in the family, they are associated with seizures. But for a layman looking around, I think the best they can do is to just ask if they are his family. But I don't know if I'm married too, but I didn't ask that question. When I wanted to get
people would want to know these days. They would just want to know what are the family history, health wise. Let's know. I
understand, but well, we can't. Okay, if you ask about epilepsy, you ask about what. There are so many diseases.
Yeah, there are a lot of them.
What I feel is that if there is a family history of epilepsy, it's ideal that they should inform prospective spouses and see if it's something that has a genetic basis, so that we can anticipate and manage. Because there are some syndromes, like I pointed out, they are genetic. They are not even see them in the father or mother, and it comes out in the children. So if we anticipate that, we ask questions around that. Well, I don't know if it's hospital setting is different from a social setting. In hospital, we ask a lot of questions around that. But I don't know about spouses, potential spouses asking them. I don't know. It might just be maybe the woman is considering you. You ask the question and she puts you off. So you need to look for another. Or the husband, the man is just contemplating, and you just gave him a chance to say, "Please go." So if you are going to answer in a social setting, it's better you find out
rather than asking.
But that's a personal thing. That's not. I
would agree with you. So now let's talk about those that are convulsing and those that are epileptic. Now, in some cases, the reason why it looks like either convulsion or epilepsy becomes very dramatic and dangerous, and then there are damages and all, is because the people around them, as a matter of fact, the person,
they don't know what to do.
They don't know what to do. And before we start talking about what they should do when it happens, these people don't know that convulsion is coming. They do not know that the attack of epilepsy is coming. For convulsion and epilepsy, are there some signs you'll be seeing a day or two before, hours before epilepsy will come in? Or what are we supposed to look out for that? Okay, this thing is coming. Prepare, bring water, bring this and all. Don't let it come. Is there any signs like that?
Yes, there are. Because the commonest form of seizures of convulsion we see in children are febrile convulsions. So that means that the fever would have started before the convulsion. So that's why we ask every parent that the number one, they should have a thermometer.
A thermometer,
particularly the digital thermometer, so that they can check their baby's temperature from time and know when it's getting high. Usually febrile convulsion does not occur when the temperature is less than 38 degrees Celsius. So when you check your baby's temperature and it's going higher than 38 degrees Celsius, so you start wondering that let me give paracetamol to bring down the fever. Let me tepisponge or bathe the baby so that the temperature can
bring
come
down the fever. Yes.
So once we bring down the fever, then convulsion will not come. That's the preventive measure for febrile convulsion. It's basically bringing down the fever, because what triggers the convulsion is the sudden high rise in temperature. So in that form, that's common. Then the other ones too, even when you talk about meningitis and all those, then the baby would have been having fever, having complaining of headache and in older children before even the convulsion comes in. So for many of the acute cases, or in case of hypoglycemia, probably baby has been sick and has not been eating, so the blood sugar level is dropping gradually. So if we have presented in the hospital earlier, we would have admitted the baby and give glucose via the vein, and then prevent the blood glucose going down enough to be a cause of the convulsion.
To put it back to level.
So it's ideally is that when babies are sick, bring them to the hospital early, and that will prevent the convulsion. Unlike the case of epilepsy, where it's unprovoked convulsion. That means that you might not be able to say what happened. But even in such cases, particularly in older children, they have what we call aura. Aura is that they have that feeling too, that I'm about to convulse. For some of them, the aura is that they start seeing flickers of light. Some they start hearing some sound, they know that this convulsion is coming. So for some of them, they have signs they see too. And then
so the signs differ.
The signs differ.
Okay.
The signs differ, and then they can, if they know, they can just put themselves in a safe place where they will not harm themselves. Because usually what becomes more dramatic about convulsion is during the convulsion, the patient is likely to come to harm.
Yes.
Probably eating the head on the floor, eating the head on it. So if he knows that you are having that feeling, if he's on medication, you can take your drugs and then lie down somewhere where there is
somewhere safe,
where you don't have to be falling down from the chair onto the floor or something. You can just lie down on the floor on a soft ground, take the medication, lie down on the soft ground, so that the medication should prevent the seizure. And even if the convulsions still come, you at least not be close to any sharp object or anything that can harm the patient.
Thank you very much, Dr. Mayegun Rilwan. I must tell you, fantastic one from your end there. I will take in calls. I see the calls are coming in, but I need us to get to a very good point before we start taking in calls. So another thing I would ask is this: when we talk about convulsion and even epilepsy, I need you to hold on the calls first. Let's get to a junction first. When we talk about convulsion and epilepsy, to those that already have it, we are still going to talk about the preventive measures and how to handle situations and cases when it happens. Those that have this convulsion and epilepsy, how can they treat it? Is it curable? Is it a curable disease, or is it just something they can manage? It cannot be cured.
Yes, so it can be cured. Totally. That's the good news. Yes.
Wow.
But depending on the etiology.
Oh, okay.
Now, like I pointed out, anybody that has febrile convulsion, that is, the fever comes before the convulsion.
Okay.
You can always take care of the fever and then prevent the convulsion. A patient that has meningitis, if the meningitis is properly treated, then the convulsion stops. And all the other acute causes of convulsion. If there is low sugar and you bring up the sugar, the convulsion stops. That is that. Now, for those that now have epilepsy,
yes,
that is unprovoked seizures that we call. So we have what we call anti-epileptic drugs.
Okay.
So what they should do is, after investigation, coming to the hospital, we investigate to see. Because, for example, anybody that is convulsing and has a brain tumor, the ideal thing is to remove the brain tumor and not just using drugs. But when we have done the basic investigations and we realize that this patient will benefit from drugs, so what we do is to start the anti-epileptic drugs. And many times, once they are on anti-epileptic drugs, it goes. Like the epilepsy stops. Now, ideally, if we can now have a period of like 2 years and there was no epilepsy, then we can, there was no convulsion, and then we can now start bringing down, reducing the doses of the anti-epileptic drug. And we have seen many many children that we started on anti-epileptic drugs and they did well, and we stopped the anti-epileptic drugs and they remain convulsion free throughout their life. So but it's very important. Where we have issues is when people start and they see the improvement, they go spiritual and feel that they have been cured, and then they stop their
because I was going to ask you that they say that you cannot medically cure epilepsy except it is traditional tradu. That's
not true. That's not true. We have cured several cases of epilepsy. Of course, we have
and it stopped totally.
So we have the recalcitrant epilepsy. For example, a baby that has soft. I'm making a lot of emphasis on babies that do not cry at birth because that's a common cause of epilepsy too. Now, when a baby did not cry at birth and the brain suffered a lot of damage. Now, in such babies, when they start convulsing, what we do many times is to just give the drugs that will stop because the damage to the brain might be a permanent one that cannot be redeemed. But there are some form of epilepsy, common, you call it idiopathic epilepsy in the past, that the baby just, you do all the investigations, you see that it's almost normal. So what you just do is to start the anti-epileptic drugs and it goes. Then you repeat the test and you find out that the baby is okay. You stop you taper off. We don't stop the medication suddenly because the patient would have been on it for a long time. So when you stop, you taper off the dose of the medication, and after that 2 years, baby is okay and they become okay for life. Our major challenges is patients don't stick to their doctors because they have to believe that they have to go spiritual. So many times they now stop their drugs from spiritual advice, and then they have another attack and they have another convulsion and felt that their enemies are back again, and then
they activated.
They go through that life. But the truth is that epilepsy is something that we can manage. There are some that are very difficult to manage. Most of them can be easily managed by using anti-epileptic drugs. Most of them.
Okay, so now let's get straight into business because people will want to know. They want to know how can we then care for children that are convulsing when it happens. I
think we need to explain again what we said, that convulsion is multiple manifestation of seizures. Seizures happen in the past. So, but in the brain. But epilepsy is just unprovoked convulsion. So epilepsy is a form of convulsion. They are not two different things. So convulsion is when the body starts shaking abnormally. Yes. But when usually what causes that is that, in children, what causes that in children is when they are sick. Now, when you now have a baby that is not sick, quoted, and then quoted is not sick, and then started convulsing, unprovoked seizures, that's when we start talking about epilepsy. And that's what Yoruba calls warapa. And yes, that's why it's good that we're having this discussion. It's surprising really what the populace believe. Of course, African magic and all these things, they form people's idea more than the scientific word. But please, I need to let us know this, that epilepsy, whatever name we call it in different languages and cultures, is something that can be cured. It can be cured. It's something that we have drugs for. What we need patients to do, come to the hospital and listen to your doctors. Many times I wonder, the question he asked was that can we use herbal concoction? So I understand that our culture has a strong influence on us, and it's very, very difficult for us to convince people about what they have been used to. So what we advise people is, even when you want to use anything, please use the orthodox medicine. Before you can add prayer, you can add anything. We're all religious people, but make sure you are doing the right thing and use the other spiritual thing as addendum. Not jettison orthodox medicine and be going spiritual for what can be cured. We have several examples. There is a particular patient we manage. The patient was in the village, has repeated convulsions, and so because that's one of the complications of convulsion. When a patient has epilepsy and is having repeated convulsion, is not being taken care of, it damages the brain. So it affects the academic performance, affects the social life of the baby and of the patient, and the patient generally goes down. So one of our nurses just went back home and she learned about this patient. They had a lot of scarification marks, a lot of verbal concussion giving, and the fact is like they have almost condemned the child to his fate. But she now brought the child to the hospital. We started anti-epileptic drug and the convulsion disappeared.
Imagine.
And then the baby started going to school, better life and all this. And so because people have that belief that if epilepsy cannot be cured in the hospital, they abandon those children to their fate. And in most cases, like I pointed out, there are some difficult to treat epilepsy, we still get there. But in most cases, many of them, even the first anticonvulsant you give, they are okay. And then the convulsion, initially we want improvement. If child is convulsing every day, when we start the drug, it turns to every week, then later every month, then later once a year, and later it spans out.
It goes off.
And that is so please
it's a gradual process and requires patience. Yes.
For everybody that is listening to me, our appeal is that we should know that epilepsy can be treated, and we have treated a lot of patients. And the ones that are at home suffering, being taken away from public and being taken away from school because they don't go to school. They don't, there are a lot of things, and it affects their social life, it dampens their potential. Please bring them to the hospital, and I can assure you by the grace of God, they will get their medications and they will be treated.
I should also let our listeners know that just like you have rightly said, traditional is not bad, but then the one question you should ask yourself most times is, you would hardly see a traditional medicine that will give you proper gauge, proper dosage of use. You would hardly see, when you take medicines, they will tell you take 2, take 3, take 1. So please, I advise that, just like the doctor have said, always visit your doctor and listen to your doctor. It is very, very important. Doctor, please, let's talk about what we should do, what parents should do when convulsion starts in a child. What should we do normally? I've heard of a lot. Some will say put spoon in the mouth. Some will say pour salt. Some will say pour water on the leg. Onions. Some will say hold the 2 legs. Grinded pepper. A lot. They'll say hold the 2 legs, spread it apart, blow the chest.
Put the legs in the fire.
But so what should we do medically when a child has convulsion?
So, like I pointed out, the commonest cause, our emphasis is on febrile convulsion because, like I pointed out, that's the commonest type of convulsion when babies have fever, and that's why they are convulsing. Now, the good thing is that most times the convulsion or febrile convulsion does not last beyond 5 minutes. And that's why you see that even before they get to the hospital, the convulsion would have stopped. So what we will expect parents to do, if your baby has fever and is convulsing, what you should just do is to loosen out. If there are tight clothing on the child, remove the tight clothing so that the baby is not constrained in the clothes, and then expose the baby so that you can bring down the fever. We want to avoid putting anything in the mouth, because a patient that is convulsing, if you force any herbal concoction, any water, anything in the mouth, the baby can aspirate it.
Not even spoon.
Not even spoon. I will still get to that, but I mean that anything. Don't put anything in the mouth. Particularly in terms of giving herbal concoction, giving water, or giving anything, because in the front of convulsion, the child might be unconscious and then aspirate. Aspirate means that, and we have 2 pipes in our neck, our throat. One takes water and food, the other takes air to the lungs. Now there is a way, as we are talking, as we are arranging, that we prevent, even when we eat, we prevent food from getting to the wrong place, and that is going where the air should go. That's why we tell children not to speak, not to talk while eating, because if they do that, the food can go the wrong way. But an unconscious child cannot control that movement. So when you pour anything in the mouth of it
might go the wrong way.
It might go the wrong way, and that is even more likely to kill the baby, to kill the child, than the convulsion. So what we expect parents to do is, like I pointed out, remove the clothing, expose the child, and bring the child to the hospital. You don't need to put spoon in the mouth, or even your hand. I've seen more parents whose hands are almost cut off because they put the hand, because that's another belief, that they feel that once the teeth are clenched together, that means that the baby is dying. That is never the issue. That is never the issue. The idea we could have is that the baby might beat on his own tongue and start bleeding from the tongue. But let's avoid putting spoon, putting onions in the eyes, pepper, very terrible things people do. That when and like I pointed out, in 5 minutes, many times the convulsion subsides, then the baby starts suffering from the evil of our good intention. Because the onions, I've seen babies gone blind because of the number of things that were put in the eyes when the child was convulsing. I've seen a child with bones of the leg, the 2 legs gone because they put the leg in fire, in coal, hot fire, because the child was convulsing. Now this child, in 5 minutes, I pointed out the child is back. But the leg will not be healed even in the next 2 months.
And some people will still say it is because of what they did. That's what brought the child back.
Exactly. So in many cases, like I said, over many cases, the convulsion stops in 5 minutes, at most 15 minutes. So, but when we now do other things that are not necessary, the harm of our intervention continues for months and weeks. So please, for emphasis, what we expect us to do when children are convulsing is that you carry you make sure that they don't harm themselves, they don't fall on a hard thing, take harmful things away from
them on a plain ground.
Put them on a plain ground. You can even carry them. I mean, for younger children, we can carry them and make sure they are not constricted. Allow them to have their movement. It will subside. And if it doesn't, it will take them to the hospital. But meanwhile, expose them so that if it's fever convulsion, the fever will come down and then the baby will gain consciousness. But it's always important that even when the convulsion subsides, that you still get to the hospital. Convulsion is not something you manage at home and stay at home. Once you expose the baby, bathe the baby or anything, and the fever comes down, still bring the child to the hospital. We need to know what is causing the fever that is making the baby to convulse. Because the baby is still likely to convulse again. 30% of patients that convulse, children that convulse without fever convulsion, we also have another episode. When they have had 2 or more episodes, 50% of them will even have more episodes. So you need to know what is the cause of the fever, so that we can treat the cause of the fever and prevent the convulsion. Now, for in cases of epilepsy means that there is nothing really, no fever, nothing. What you just need to do is, the child is convulsing, take the child to a plain ground where there is no harmful, and because some of them will be hitting their head on the floor or hitting their body on any harmful thing. Make sure the environment is clear and allow them to wean off the convulsion and bring them to the hospital. But for some epilepsy that we are still managing to control, we have medications we give the mother that if they are convulsing, put this in their mouth, not to swallow. Put it in the buccal mucosa so that brings down the convulsion.
Okay, when you say buccal mucosa, that means
I mean the mouth.
Okay.
Put them in their mouth, but not something we want them to swallow. Emphasis on putting it on the cheek, because like I pointed out, we don't want them to swallow anything because it can go the wrong way. So we put them in their mouth so that it is absorbed in their mouth, goes to their bloodstream and bring down the convulsion, particularly when it gets prolonged. And this is also the same thing for an adult. When an adult is convulsing, I mean in case of epilepsy in an adult, what we should just do is make the environment, clear the environment, and make sure the patient does not aspirate, because an adult might actually be foaming.
Yes.
So what we want is that you put them on their left side so that they are not likely to aspirate their saliva. And it's also important to let us know that their saliva is not contagious. Of course,
I was going to ask that.
Yes, every body fluid is carries infection generally.
Yes.
So we are not encouraged, we are not advised to be touching body fluids of others. But generally, it doesn't mean that once the saliva of a patient with epilepsy touches you, you have epilepsy. That's very, very bad.
I've heard of cases where they have to actually the chair where the person they had to chop up that part away and sit.
No, that's not true. So because the saliva just comes because the patient is unconscious. We produce a lot of saliva even as we are talking here.
Yes.
But because we are swallowing it, we don't know. But the patient that is convulsing that could not swallow his own, that's why it's much and starts coming out. But it's only carrying an infection other than that of any other member of the population. What we just need to do is prevent them from harming themselves. A lot of emphasis here, because sometimes how you know if a patient has bad epilepsy is you see injury all over.
Yes.
So that means that when the convulsions are happening, the patient come to harm whenever there is this convulsion. So that's what we want, to prevent that harm and then bring the child to the hospital.
According to you, now the best way to prevent this or handle cases of convulsion in children is to make them calm, taking off their clothes so they can have fresh air, and then after 5 minutes when the thing is over, they bring them to the hospital. How about people that do not even have opportunity of coming to the hospital at that time? if the child just stops after 5 minutes or maximum 15 minutes and they do not have the opportunity of coming to the hospital, is it still fine for them to keep that child until maybe a day after and visit the hospital, or by force the child should visit the hospital that day when that incident happens?
Yes, we advise every patient, every mother or father that has a child convulsing to come to the hospital immediately. Yes, I remember I had a call about that was even a 20-something day old baby. And immediately he told me there was convulsion, you need to get to the hospital immediately. It's the baby had meningitis. Meningitis is a very severe infection. Waiting till the next day worsens the prognosis. So I will advise every parent whose child is convulsing to visit the hospital. The only exception will be patients that we are managing already.
Okay.
And then those with epilepsy that we are already managing, that
has begun treatment already.
Okay. So, and many times we have what we call parent education. We would have advised them that if it even becomes more frequent than it used to be, we ask them to still come to the hospital so that we can review the medications and find a way of properly managing the epilepsy.
Doctor, I want to say thank you so very much. Our time is fast spent. We have less than 3 minutes to sign out on the show, but then I still know you have so much to talk about. So in just 2 minutes, what would our take-home advice be from you as a doctor to all of our listeners out there?
Now, thank you everybody for listening to us. I'm happy we are discussing this issue because this is an opportunity I've been looking for personally to convince our people that most of the things we think they are spiritual are not spiritual. Please, whenever you have your babies convulsing, come to the hospital. And I want to assure us that there are medications for this. And like I pointed out, most cases can be managed easily. There are some difficult to manage cases, but most cases can be managed. And then please, when you come to the hospital, be patient with your doctor. Be patient with your doctor. Ask questions. When you don't have any improvement, come back again. We always tell patients, when you have issues, come back. We are here for you. Come back and come back and come back until you are satisfied. But some people, once they come once or twice, they feel that there is nothing, let me just go spiritual. And then in that way, you worsen the outcome on the patient, of the baby start convulsing in school, and it has a lot of stigmatization that it affects the child, the social life of the child, expose the child to bullying and all that. So please, my advice for us, when your child is convulsing, please don't put anything in the mouth or the nose. Don't put the legs in fire. Don't put the hands into fire. Don't harm the baby. What you just do is that make the environment calm and rush the baby to the hospital. Expose the child and bring the baby to the hospital. I wish every one of us that we have healthy children and they all become healthy adults. Thank you for listening.
Thank you so very much, Dr. Mayegun Rilwan from General Hospital Ikorodu. This is how far we would have it today on the issues. And of course, feel free to visit your doctor anytime, any day. And I will tell you for free that when you get to General Hospital Ikorodu, you will be attended to. All you need to do is be patient, relax, and of course, expect the very best of professionals to attend to you. And I say thank you to the staff and management of General Hospital Ikorodu too as well. I apologize to those of you that are called in and I could not take the call. It was important for us to listen and learn from the doctor. To those of you who called in, thank you so very much for contributing. My name is Adebambo Opayemi. Let's do this again tomorrow, same time, same station. God bless Nigeria. God bless Lagos. God bless every child out there. God bless every parent out there. Happy New Month and happy Global Parents Day. It's a bye for now.